There's been some talk this morning about the Affordable Care Act and what the reform efforts are trying to do and what they're not trying to do. And I want to associate myself with the comments made by our colleague and the senator from Nebraska earlier today. A lot of talk has been thrown around about how the new effort would cut Medicaid spending. As my colleague from Nebraska mentioned, here in Washington, a cut is not a cut anywhere else. But if you deal with the rate of growth, you deal with and only raise spending by the consumer price index rather than the medical consumer price index, of 5% rather 6%, for example, then you are somehow cutting the program when we know that the program as it currently stands is unsustainable. I think we all recognize that. And so any effort to deal and to allow governors and others at the local level to have more of a say on how these funds are spent and to gain efficiencies that way are frowned upon. Or we say we simply can't do that because it would be cutting Medicaid. That simply isn't the case. Arizona, for example, our version of Medicaid is called Access. It's done far more efficiently than some of the other states do it. That's because at the local level, they've been able to do what local governments do best. Governments closer to the people generally spend money more wisely and find efficiencies that the federal government simply can't find. Let me mention on the exchange, the Affordable Care Act dealt with a couple of different things. A so-called exchange, where people who can't get insurance otherwise or don't get it through their employers will buy it on either a federal exchange or a state exchange. And then you have the Medicaid side. Let me speak for a minute on the exchange side. Arizona has been ground zero for the failure of the Obamacare exchange. We have 15 counties in Arizona. In all 15 counties, if you are a family of 4 and you're buying on the exchange, you're paying more on the average for your health care premium than you are for your mortgage. Think about that for a minute. Paying more for your health care premium than you are for your mortgage in every county in Arizona. In some counties in Arizona, you're paying double. In every county it's more, some counties significantly more. In a couple of counties you're paying double for your health care premium what you are for your mortgage. I spoke yesterday with an elected official from Arizona, from one of the rural counties. He told me that his health care premium, which he simply can't afford anymore for his family, 4 children, it would have been $2,800 a month. That's what it's gone up from. It's doubled virtually every year. We saw in some counties in Arizona 116% increases. His own, prior to Obamacare coming in, he was paying a reasonable amount for a premium and had copays and deductibles that were reasonable as well. But then when the Affordable Care Act came in, the promise that you could keep your doctor or keep your plan simply wasn't the case. And his premiums have gone up and up and up until now. The premium, $2,800. $2,800 monthly for his family, 4 children. Keep in mind as well that the deductibles on top of that, were he to use that insurance, by the time you satisfy the family deductibles, it's about $12,000. So he has paid, or he will pay if he has any medical issues, between premiums and deductibles, more than $40,000 before the first insurance dollar kicks in. So when we hear from the other side of the aisle that there's no problem with Obamacare, that the only thing we have to worry about is some people who have gained insurance and to make sure they keep that, I agree. We've got to make sure that those with pre-existing conditions have access to affordable care. But when you have people on the exchange who simply cannot find affordable care, and then if they do have a policy, they can't afford to use it because deductibles and copays are so high, we have a problem. The latest figures tell us that 155,000 Arizonans woke up this morning without any insurance. Most of them had insurance prior to the Affordable Care Act, but then insurance was priced out of their reach. 155,000 are paying a fine to the federal government because of their inability to find affordable insurance. They pay that fine and they still have no insurance. Now tell me that that's not something we've got to fix. We've got to fix that. That's what we're responding to here. And this notion that it's all hunky-dory, keep with the plan, belies the fact that 155,000 Arizonans wake up this morning and say, we're paying a fine to the federal government because we can't find affordable care, and still we have no care. And we're somehow supposed to be okay with that, and somehow supposed to wait until we can find a solution for it all before we address that specific situation. So, Mr. President, I would submit that we've got to fix this. People in Arizona and elsewhere are hurting. And let's stop with the rhetoric that this is somehow a cut and people are going to be left on the streets. We heard that back in 1996 with welfare reform. It was said that the governors or others at the local level couldn't participate, couldn't be in charge of this program because people would be dying on the streets. Well, guess what? Within a couple of years, the welfare rolls have been cut in half. We were doing better, and the federal government's obligation in that regard has been sustainable, unlike the current situation we have with the so-called Affordable Care Act. So, Mr. President, I hope that we can stop the outrageous rhetoric on this and actually fix the problem for Arizonans who are hurting right now. With that, I yield back.